Welcome to this special episode of Neuro Stories, created to accompany the TV series Trauma Room 1, which focuses on neurosurgery here at the Walton Centre. In these episodes, we go beyond the screen to bring you closer to the incredible staff and patients featured in the documentary, delivering outstanding services every day.
So my name's Chloe. I'm one of the physiotherapists that works here at the Walton Centre.
So my name's Suzy, one of the sisters here in theatre recovery.
Tell me a little bit about what it was like having Trauma Room 1's film crew in the theatres department over the summer.
A little bit bizarre at times to see people, when you're coming to work every day and you're just doing your everyday business and then there's a big film crew, but it's also very exciting. And I know it's something that everybody's friends and families have all got, involved in watching. I know my mum's every week. She can't wait to see what we've been up to.
It was a bit of a strange experience, really, to be filmed and have the cameramen sort of follow us around with the patients. But it was just having to pretend like they're not there and still introduce myself to the patient and do their treatment as if they weren't filming. A bit of a strange one, but I thought how great the patients were, to be honest. They really weren't thrown off by the cameramen being there.
Yeah, I think it's very different to what happens on like Casualty and Holby City and programs like that. So it is really nice to see what really goes on. But again, it is very bizarre to be filmed going about your daily business and you feel like you do it naturally every day.
What did you think when we sort of came to the department and said, are you happy to get involved?
I think it's really exciting because I think we are at the cutting edge of a lot of things here and it's nice for people to see what we're doing. It's like a window into the working world of all the team, and I think it's exciting to see what goes on behind the scenes, because not everyone knows there might be a nurse and a surgeon, but to see all the different, I know there's been people from speech and language and there's been all different, especially the thrombectomy service. I think it's lovely to see the cutting edge of what we do here.
I was quite excited because I'd watched the first series when it was out a couple of years ago. I was more than happy to be filmed. I think it's a nice way to kind of showcase what we do. A lot of people wouldn't really know exactly what the role of a physiotherapist is in a hospital, especially in like a neuro hospital.
It is a multidisciplinary team. There are a lot of different professions and a lot of different therapies that are basically activated in a patient's care almost as soon as they cross the threshold, whether that's an emergency or a planned treatment. Do you think that the series has been quite good at that, at showing the MDT?
Yeah, definitely. I think it's been really good at showing all the roles of therapists. Obviously, the first episode, you've got a lot with Hannah, the speech and language therapist. That's amazing to see what she does in the surgeries, and then sort of showcasing the physio and the OT side as well as it goes through. Because obviously it is amazing what the surgeons do, but there is all these other roles working behind the scenes to get that patient as best as they can be before they go home and make sure they're going to manage and be okay with things like their mobility.
It's amazing, isn't it, how many people come together to get one person's surgery done. It's amazing.
So have you seen yourself on any of the episodes? Have you watched any?
Yeah, so I've been watching them. I haven't caught up with last night because I was in work. So I have been on the telly. Bit bizarre to see yourself on the telly. And my daughter was very excited because she was saying, Mummy, you're famous. So I was only going down a corridor pushing a trolley. But again, I do remember the film crew there and I was thinking, just please don't crash, don't. And it's very hard to not look at the camera as well. But yeah, it's exciting to see yourself on the telly, and it's especially my daughter, she loved it.
A bit strange, really. Sort of my family and friends are all very excited about it, and it's kind of nice to see that I've been kind of showcased for what I do. But it's just a little bit strange to see yourself on TV. A lot of people just assume as physiotherapists that I just get called a nurse quite a lot. It's just that like umbrella, just you work in a hospital, so there's no real understanding about what my role is. So it was a good way to kind of showcase that, and everyone was really sort of proud of me, which was really nice.
It was really good with the patient story you featured in. He'd had a tumour removed from his spine, I think, and you were obviously putting him through his paces in the gym. And I think people don't realise that that's quite quickly after they've had the surgery. Why is that important to get them up and about?
Yeah, so it's really important day one after these kind of operations to get somebody up out of bed, as long as things like the blood pressure's stable and they're not in excruciating amounts of pain, because the longer you stay in bed, there's all things like deconditioning and you get weaker. And obviously the kind of operation they've had where it is the surgeons are going into the spinal cord, it's really important that we pick up if there's been any like neurological changes or any sort of new limb weaknesses or forward sensation, because the spinal cord is such a very detailed part of the body where the surgeries, as you've seen in the program, sometimes it can impact their sensation and limb weakness. So we have to sort of assess that straight away.
And again, it's that example, isn't it, of what you were saying just now about people not realizing that something like physiotherapy starts immediately when they come to the ward after they've had their operation.
Even for some patients will get involved before their operation if they've been admitted, do sort of a baseline assessment with the knowledge of that they might have some deficits after, depending on what their injury is, and start that ball rolling about what they're going to need going forwards. Are they going to need like equipment or a walking aid, or are they going to need any sort of support in the community? So we do get involved quite early on, really.
How does it feel for you to be, whether the cameras are there or not, how does it feel to be a part of a patient's story like that?
Oh, I think it's wonderful, and especially like in my role in recovery, sometimes we're fortunate enough we collect them from the ward, so then we can see them pre-op, we can introduce ourselves, have a little chat with them, and then we actually see them in recovery. So it's just lovely to see that journey. And then especially a lot of patients may or may not remember you, but it's nice to go up and follow up your patients the next day. And if you pass them in the bay, it's nice to have a chat with them and see you've seen them from pre-op. So they might have been in pain or, have difficulties, and then we see them in recovery, and then we get to see them the day after, and it's lovely catching up with them and just seeing that patient's journey.
It's a really good feeling, isn't it?
Yeah, I think it just puts it into perspective that these are real people with real lives and, real families, and that you've seen that they've gone through such hardship, and then to see them coming out the other side is lovely. And I know it's not always, it can't always be the wonderful fairy tale, ending of the story, but it's nice to see that things are going well for them and they're progressing.
And what is it like for you working at the Walton Centre then?
I love it here. I've only been here just over a year, working at Walton Centre, and it was always sort of in my head that I'd want to end up working here, because it is that specialist sort of neuro area, which is an area that I've always been interested in physiotherapy. I've met such amazing people that work here, and everyone does such an incredible job. It feels like a bit of a privilege to be working here. So I'm glad I made that jump a year ago to change to work here.
What's it like working with other teams in that multidisciplinary team way?
Yeah, we work so closely with all the different teams. So at the minute, I'm now on ITU. So I'm not on the acute wards. We sort of rotate in our role. We do 9 months in different areas. So I've just recently gone on to respiratory on intensive care, and it's amazing sort of how close we work with like speech and language therapy. We do a lot of joint assessments, like our tracheal patients, work so closely with like the medical team. They really listen to kind of our recommendations, because we see the patients every day, twice a day, sometimes 3 times a day, and get to know them so well. So all the medical team are so open to us suggesting things or altering weaning plans for the patient. And obviously we work really closely with the nurses as well and have a great relationship with them. We all work so closely and we all respect each other's roles massively, and everybody's got such an important role in someone's journey.
And do you think that enhances patient care here?
Yeah, definitely. Yeah, I think it's so important to have that. Everyone's looking at a slightly different thing with a patient, so it's that holistic approach, and the patient's going to have the best journey when all these decisions are made through the MDT, with everybody making sure that patient has the best care and the best journey through the hospital.
What's it like working in theatre recovery at the Walton Centre?
I love coming to work. I know when people say like, oh, and it's very rare that I don't want to come to work. It's a lovely place. It's nice to have that one-to-one interaction with my patients. I've done ward nursing, and I just feel like this suits my nursing abilities. It's all one-to-one. You're able to reassure your patients. They're very scared and vulnerable after an anaesthetic. If anyone's ever had an anaesthetic, you know how you're feeling. It's a very scary environment. So it's lovely to put my patients at ease and make them feel as safe as they can after an anaesthetic. Can be very daunting. I can give them pain relief, I can give them anti-sickness medicines, because I'm there one-to-one, primarily just looking after them. It's nice to have a chat with them, and especially when they're coming out of the anaesthetic and they're a little bit more chatty. It's lovely to have that. It's very rewarding.
A key part really to getting them well after they've had a surgery.
It's the first road to recovery, and then we take them up to the ward and get them settled in with the ward staff.
What do you hope people will think when they see the MDT? They'll see physiotherapists in action.
I hope that it will help people who in the future do have to be admitted to the Walton Centre for different reasons, or if they have any issues with their own sort of brain or spinal cord. If they watch that series, then hopefully it kind of put their mind at ease a little bit to see how sort of smooth the process is and how successful it is, and then help them understand all the different teams that are going to get involved and support them through it, and just to help sort of everybody understand what it is that we do here and what an amazing job that everybody who works here does.
I just would love people just to obviously know what we're doing here and the work that we're doing, and that the NHS is spoken about a lot with the press and the government, and it's just nice to see that actually everyone's trying their best for the patients, and everyone just wants the best for their patients. And I think that just comes across so lovely, and it's such a lovely place to work. It's very family orientated. I feel like everyone knows everybody. That hopefully comes across in the documentary. We all want the best outcome for the patients.
I really love my job. I'm so happy I made the decision to go into physiotherapy. It's so rewarding to see kind of the impact that we have, and we get a lot of patients that come through and then they go home and they come back and see us, and it's really, really rewarding when they've said, oh, I'm walking really well now. It is a specialist trust, and we do have real outstanding people that work here, and it's really nice for that to have been showcased.
Thanks for listening to this special episode of Neuro Stories. All episodes of Trauma Room 1 are available to watch on My5. Just search Trauma Room 1 to catch up on the latest season now. For more episodes of the podcast, find us on Spotify, Apple Podcasts and YouTube, and stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.